In this video guide, we discuss everything you need to know about CBD oil for Alzheimer's, including information on all the latest medical and academic studies. We know that Alzheimer's disease is a cognitive, progressive neurodegenerative condition. In fact, a publication in Basic Neurochemistry describes Alzheimer's as the most common basis for late-life cognitive failure. Regarding the potential use of CBD oil for Alzheimer's disease, the NIH PubChem database lists neuroprotective activity as one of the investigated uses of CBD. It's possible that administration of CBD as a neuroprotective agent could hold benefit in terms of both preventing Alzheimer's disease and reducing its symptoms in patients. Of course, it's important to point out that there is currently no clinical data or evidence to support this. We know that CBD possesses neuroprotective activity, but we don't know how, or even if, this may be applicable in relation to the neurochemical physiology of Alzheimer's disease. In a brain with Alzheimer's, a buildup of beta-amyloid proteins slows down communication between nerve cells in the central nervous system. When these proteins build up, they form clusters in the brain known as plaques and tangles. Tangles can result in nerve cells not receiving important chemical messages, which eventually causes them to die. Chemicals within the brain that allow signals to pass between nerve cells are also drastically reduced in Alzheimer's patients. Also, Alzheimer's disease is progressive, meaning its effects tend to develop and increase over time as a result of more and more cells becoming deteriorated. Eventually, so many cells are lost that it affects almost every aspect of a patient's daily life. This includes things like basic motor skills, language, and ability to process memories. One interesting study on the potential of effects of CBD for Alzheimer's was published in 2016 in the Journal of Aging and Mechanisms of Disease. In the study, researchers pointed out that cannabinoids actually have the ability to remove plaque-forming Alzheimer's proteins from brain cells. While the study focused mostly on THC, it did specifically mention the use of cannabinoids, suggesting that CBD may have a similar cellular effect. A separate in vitro study on rat cells, published in the Journal of Neurochemistry, observed central nervous system cells that were treated with CBD prior to exposure to beta-amyloid proteins. While data was limited, researchers ultimately concluded that CBD could help to galvanize protective effects on the CNS cells. Another 2017 review in Frontiers in Pharmacology claimed that there is data to support the notion that CBD can promote the growth of brain cells in the central nervous system. When CBD was given to Alzheimer's disease rodent models, for example, it appeared to slow down the decline of memory and overall cognitive function. And on a more practical level, it's worth pointing out that many individuals are already using CBD to treat things like anxiety, depression, stress, and trouble sleeping, all of which can be side effects of Alzheimer's disease. The big question, of course, is whether or not CBD oil for Alzheimer's can be used to slow down the progression of the disease in the same way that prescription medications do. Unfortunately, there is currently no definitive clinical research on this topic. With rapidly increasing scientific interest in CBD, however, as well as increased accessibility, we expect more studies on the use of CBD oil for Alzheimer's to surface in the coming years. For some of the best hemp-based CBD oils currently on the market, which are available in most every US state, be sure to head over to the Way of Leaf website, where we've reviewed and cataloged hundreds of different hemp-derived CBD products. We also offer hundreds of doctor-reviewed articles on the use of CBD and cannabis for dozens of medical conditions, so be sure to check out this wealth of informational resources. Thanks for tuning in, and we'll see you next time.